The procedure that I have today is rhinoplasty, breast augmentation, and liposuction. One day I was looking in the website and I find Dr. Kim and I see his before and after videos and I think he's a great doctor, so that's why I choose Dr. Kim.
When I first saw Fabiola, she had nice perky breasts. She hadn't had any children, so she was still very thin and in good shape. But she did have an area of fat collection on the hips, which was taking away from her figure a little bit. She had a bump to her nose and a little bit large tip. So the plan was to do a rhinoplasty to remove the bump and at the same time reducing her tip and enlarging the breast.
I'm about to go in my procedure and I feel like so excited. I just want to go and do it and see the results.
We did the procedure. We started with the breast augmentation first. She wanted to have minimal scarring, so we decided to do the umbilical technique, which is just placing a small cut on the upper portion of the belly button. She wanted to be rather large. We did about a D cup on her for her breast. Okay, so now I got the implants in place. Looking pretty even. I'm gonna make some small adjustments still, but we have 475 on the left, 500 on the right. Next we did the liposuction, which is again is just putting a couple little holes on the side, filling the fat up with some solution so there's not so much pain, not so much bleeding afterwards, and then sucking the fat out. And she did fine with that. And then lastly, we did the nose. So we took down the bump, reduced her tip, decreased the projection. Since I'm doing some tip work, I'm using an open approach. That's where we had to cut across columella so I can lift the skin up. And I just kind of check as I'm going along to see how it looks. And now I'm just kind of putting the little finishing touches on the tip. And we should be done.
I'm happy with my nose. That was the most important part. I'm so happy that Dr. Kim, he did a good job. And my breasts, I like it too.
After the surgery, she came in, instructed her on how to massage, and instructed her on how to sleep in the right position. Initially, when you're healing, you want to sleep rather straight so the breasts heal evenly, as well as the nose so that the bones don't shift. She's done a very good job. She's taken good care of herself. She's worn the little corset for the liposuction for 3-4 weeks. Breasts have healed nicely. They continue to soften up every week, so she continues to do the massaging, and the nose is healed pretty well. There's not much to do for the nose at this point.
Well, but my nose, my friends are like, oh my God, you look different, but they didn't even know why. And they're like, oh, your hair looks different or why, yeah? And I said like, oh, I did my nose, and they're like, oh my God, it's so nice, it's hard to tell.
And the advantage of doing all 3 procedures at the same time is that there's only one recovery period. Also the procedure, you can save a little bit of money on the cost of the surgery since you're already there. A lot of times we try to do multiple procedures. You don't want to do too much at the same time, but for these procedures, they're all relatively short procedures, so we're able to do all 3 in just a matter of a few hours. And she's young and healthy, so she handled it well, and so far she's healing great.
The surgery changed my daily life a lot. When I try on the clothes, it looks much better, and my nose, I don't know, it's like, it's something different, because sometimes when I take pictures and I was shy to take pictures from the sides because I didn't like it, but right now I'm confident. I'm glad that I choose Dr. Kim, and definitely you do have to come with Dr. Kim. If you want to do something, come with Dr. Kim.